Hello again and welcome to my YouTube video. Today I'm going to be talking to you about hoarding in children and teenagers. My name is Tracey Maxfield. I'm a retired RN. I'm a peer specialist, educator, and a staunch stop bullying and mental health advocate. So when we think about hoarding, I expect many of you are kind of just thinking, kids don't hoard. Yeah, they're untidy, but they don't hoard. What I'm going to tell you, I think, will actually open your eyes a little bit and will surprise you. So most of us have seen all the shows on TV which shows extreme examples of hoarding, and we also see news stories where maybe someone was found deceased in their room or apartment and no one knew they were there because they'd hoarded for so long that they actually couldn't find the person amongst all the items. Now, when we see it, we always kind of shake our heads and go like, wow, couldn't you see it was getting out of control? How can you live like this? Why won't you part with anything? It's very obvious that anyone who has a hoarding problem actually has a mental illness or mental disorder. There is an emotional attachment component. So typically we always associate hoarding with adults, but children and teenagers do also hoard. And I think the reason why I want to do this is to make you more aware so you can intervene if you realize that it could be your child or teenager. But also, if we don't actually deal with this problem head on, then their behaviors will continue to escalate into adulthood. And actually it will not, hoarding will become one part of the issue, but also health problems and social isolation and depression and other factors will also come into play. So hoarding disorder has only recently been considered an actual psychiatric disorder. And it was added a few years ago to the DSM-5, which is the Psychiatric Bible or the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. And it is classified under Obsessive, Compulsive and Related Disorders category. So hoarding is defined as the acquisition and failure to discard possessions of little use or value. And approximately 2 to 6% of children and teenagers actually hoard. Now, whilst the typical age of onset of compulsive hoarding begins between the ages of 11 and 15, we do know that children as young as 6 to 7 years old actually hoard. Now, hoarding is kind of an anxiety type disorder which typically occurs with OCD, obsessive compulsive disorder, and we just discussed OCD in the last blog post and YouTube video. So I think what we need to understand is that hoarding rarely occurs on its own. And hoarding, what research has shown us is that hoarding is extremely common in children and teenagers with ASD, autism spectrum disorder, and also there's a high prevalence of hoarding in children with ADHD, attention deficit hyperactivity disorder. Also, hoarding behaviors are quite common in children with developmental disabilities and also in kids with major depressive disorder and anxiety disorders. So hoarding is itself a separate mental illness or mental disorder, but it also coexists with another mental disorder. Now, we know, right, messy rooms with kids are common. The difference is that kids who hoard tend to acquire objects or items that most of us may consider useless or have a new purpose or even garbage. And then when we ask them to part with them, they actually struggle to discard them, and they will usually relate a specific reason or a story as to why they need to keep them. These kids develop overpowering emotional attachments to their possessions, and eventually this will result not only in cluttered rooms, but also it will begin to affect their behaviors, and they become so worried that someone may actually go and take their possessions that it starts impacting their daily life. So, for example, their bedroom is so full of stuff that they don't get their homework assignments completed, or they can't find clean clothes, so they're late getting to school or going to family gatherings. The kids completely lack insight into the fact that this hoarding behavior is a problem, and typical responses, if you say clean up this room now, or that you get a garbage bag and you say, oh, this stuff has to go, as they become angry and defensive and anxious, and they actually may threaten you or threaten to harm themselves. They may cry. Children will actually throw temper tantrums. And I think what's sad is that as the problem continues to worsen and escalate, these kids eventually experience teasing and taunting and threats and bullying from their peers, social isolation, and they may be thought of as, I hate these words, but weird or crazy by their friends, who kind of try to understand, why are they hoarding? There's no need to hoard. So what research is finding is that the core features of hoarding partially arise from observed deficits in the executive functioning. So executive functioning, as you think, is socially appropriate and inappropriate behaviors, organization, sustained attention, risk-taking, long-term planning. Risk factors of a child or a teenager developing a hoarding disorder: family history, stressful event, think ACEs, adverse childhood events. What we are finding is that 50% of hoarding behavior in children and teenagers is preceded by a traumatic event: death of a parent or a very close family member, death of a pet, divorce, move to a new school or a new home, house fire. And also another risk factor is, as I mentioned earlier, pre-existing mental disorder. So approximately 25% of children and teenagers with an anxiety disorder will develop also a hoarding disorder. 20% of children and teenagers with OCD, obsessive compulsive disorder, will develop a hoarding disorder. 70% of children and teenagers with major depressive disorder can also develop a hoarding disorder, and approximately 30% of children with ADHD. So signs that your child or teenager may have a hoarding disorder. Okay, their room is full of stuff. Not that they're lazy and they haven't put it away, there is nowhere to put the stuff. So their beds may be covered with stuff and there's actually no room for them to sleep. Their desk will be covered with stuff. The bedroom floor is full of stuff, clutter. Closets and drawers are filled with stuff. Shelves, toy boxes are overflowing, containers, backpack. It's just stuff. And when I say stuff, it could be things like twigs, stones, tickets, pieces of paper. It is items that we look at and say, well, this is useless, this has no value, it's garbage. But to the child or teenager, it has a significance, an emotional attachment, and they feel like their whole world will fall apart if you suddenly go in and not only move these items, but actually put them in garbage containers and take them away from the room. So treatment of a hoarding disorder is a little bit more specialized, because remember, you also will have to treat the coexisting mental disorder as well. But treatment for hoarding actually will depend on the age of the child or the teenager. So for younger children under the age of 8, psychologists will actually typically work with the parents or the guardians to work on a behavioral plan to stop the child from acquiring more things, and to use incentives to work on gradually getting rid of all the hoarded items. For older children and teenagers, experts agree that CBT, cognitive behavioral therapy, is actually the most effective. And what the therapy does, it helps the child or teenager understand why they are hoarding, why they are using these particular items as an attachment, why they feel compelled to hoard, and then the psychologist works with the kids to teach them to decide which items are actually worth keeping and which are actually worthless, and that they can actually be discarded or donated. For those with very severe cases or may have a coexisting anxiety or obsessive compulsive disorder or major depressive disorder, medications, namely antidepressants, the SSRIs, which help elevate the serotonin and the other neurotransmitters, have been found to be quite helpful. So your child or teenager hoards. You're going for therapy, you're working with them. So what can you as a parent do to help support them during this time of transition? I think the first thing to do, as I always say, is make sure that they follow up with therapy, you become an active participant in the treatment plan, the medications are given, you be alert for signs and symptoms that things may be getting worse, especially if they have a coexisting mental disorder. You take time with them, one-on-one time, you talk with them, listen, non-judgmental. Do not tease them, do not ridicule them, do not reprimand them for their hoarding behaviour. You need to be patient, very patient, because this is going to take some time. And as I always say, be there and show love. So I think the first thing is restrict the space for hoarding. So for example, the bed is for sleeping in, the desk is for working, doing your homework, and they must be clear at all times. Use a one in, one out method. So every time they acquire a new piece of clothing or a new book or a toy or something, then they must donate one. And I think this is good because it instills values of kindness and compassion and understanding that there are other children and teenagers out there who may not have all these items that your child or teenager has, and so they're doing something that is actually good, they're paying it forward. Reward appropriate behavior. So say for example, they discard items of no value, you reward them, but that should not be with another item or a toy. It's going to be something like going to a movie, skating, pizza night, going out for ice cream treats. It's going to be that kind of family connection treat. You're going to talk with the friends and the siblings and the family, how they can help promote, reducing the hoarding and getting rid of items without intimidations or threats or punishment or belittling them. You've got to be very patient, very supportive and understanding as you, with the psychologist, start breaking that emotional attachment to the items. Now, when you talk to your kids, don't refer to it as hoarding. They like to think of it as their collection or their things, and start to understand why they're holding onto these things. Other things that you can do is encourage them to put their extra special treasured items in a special container or a memory box. You may make up collages if they're specific twigs or stones or tickets. Now remember, hoarding can also be food. And so there could be rotten food hidden under the bed, in the drawers, in the closet. That will become a health issue. Think vermin. Other things is, remember, children especially may not have access to the funds needed to acquire new items. So if they're suddenly coming home with new puzzles, books, toys, you have to find out where they come from. Did they actually steal them? And if so, was it from a store, or have they taken it from school, or have they taken it from a friend? You need to get on top of that behavior very, very quickly, because that becomes an additional issue to deal with. I think another thing is to set aside a specific day and time of the week when, with your child or teenager, you actually go to their room and you actually go through it. Just to see, has the behavior escalated again, or are they hiding things which you thought had been discarded? You check the toy box, you check their backpack. You don't want to invade their privacy, so this is a pre-arranged day and time that you go through it. So there develops an honest, trusting relationship. And so, again, very, very challenging. We know it's extremely challenging in adults. In children and teenagers, again, it is challenging, but we have the opportunity to reshape and reframe their thinking at what they classify as attachment, and help them heal and move into that recovery stage, so they have strategies and a plan to rely on when things get stressful, when things change, when they actually may go to university, move into their own home, become an adult. So I hope you found this helpful and interesting, and please check out my blog post for more information, including some references and some resources that you could use that will help you get a better understanding. Thank you for your time.